biggest public health challenges facing the UK at the moment are both physical and mental, and the two are completely interrelated. So over 60% of the UK population are overweight and half of those are obese. Very significant proportion of the population have mental health challenges. For instance, we have a very elderly population and social isolation remains a big problem for them. But the two are completely interwoven, so we see often people present with physical problems, but they are in fact borne out by some mental health problems and vice versa. So we always need to treat people in the round because you never know what the underlying cause is for either their physical or their mental challenges. We can alleviate the pressures on the system by concentrating on the preventative measures that public health can offer, looking after people's physical health, their mental well-being, in their own homes, in their communities, in their employment. There are organisations across the country who are running classes, activity classes, walking groups for people where they can come and meet like-minded people and do activities together which help with their mental health. But it's really important to connect them, to connect people to them, to make sure they know where they are, how to join, and they're not afraid to join. We also need to empower people to look after their own health and well-being. So there's a big drive at the moment which we completely embrace, which is about giving them the tools and the techniques and the information and the education to live much more active and healthy lives. Priority Digital Health is a digital health solution company based in Cambridgeshire. We're passionate about preventative health. So we want to make sure that we can help people stay fit and well and independent and look after their own health and well-being.
Our solution is twofold. One, it puts the power of digital in the hands of practitioners, healthcare professionals and providers of healthcare services where they've never had it before. And the second part of it is to put the power back into the individual itself. So the patient has the power to self-refer them into services that they've never had access to before without going to see their GP or a healthcare professional. Book themselves in, find the patient choice for them that suits them in the right locality, but also allows the healthcare professional to be able to pick those referrals up faster, more efficiently, and process them into services a lot more effectively than they've ever done before. The platform automates as much administration information as physically possible in the first instance. So it can take a referral directly from the GP system, and whether that's EMIS, System 1 or Vision, it comes straight out of them automatically into our platform. It then invites the patient to join the service. It then has a complete onboarding process which allows the call handlers to process an individual through a series of steps and onboarding them super efficiently. So, going through call 1 to call 3 and having timings alongside that. Once that's in, it allows everybody to book into particular services. It allows them to assess themselves against standard NHS and public assessments, whether that's SWEMWebs, WEMWebs, Audit C. It then allows those individuals to be managed through genuinely a 12-week program that goes through, physical fitness, weight, whatever their intervention is, and then reports on outcomes on a weekly basis. And then from a commissioner point of view, it allows us to gather all that data up and report on it. So actually we can see the cost to the public purse and how much that costs, all the way through to the physical outcome it delivers on an individual basis, by region, by area, however we want to do and produce that. In order for public health departments, local councils to hit the targets set by government, they need to embrace digital. Introducing a platform like Priority to your local service will allow you to reach the hardest people to reach inside your communities, to scale up to the levels that you need to support everybody inside your community without having to find more resource, more budgets, and more expertise to bring to that table. Very soon, we are going to be launching our whole body app. It's called Amara Health, and it is going to be a patient-focused, whole-body well-being app. Millions of people have Strava, managing their runs and cycling. There's loads of people on Weight Watchers. There's loads of people who have multiple apps on their phone. None of these apps talk to each other, so you're only ever dealing with one thing at one time, never looking at your whole approach and your whole look at it. Amara brings all of that together, brings all of those apps and some of that functionality together so you can manage your whole body well-being, not just your physical or mental or what you're eating or what you're consuming, but your whole body approach.
We're really excited about the opportunities for growth, the opportunities for digital tools to really help people in their day-to-day lives staying fit and well, but also the opportunity to connect services and organisations delivering those services both in the UK but overseas as well.